for a company called Upstream, and at Upstream we're a social business that's all about prevention. So we believe, like a lot of people, that prevention is better than the cure. The Connexin with Connexin is really important for us. So Connexin are all about harnessing data, and data's useless unless you can do something with it. And at Upstream we're all about using that data to change lives. And I think we're going to see some presentations from others doing similar things later on. When we look at the broader world we're living in right now in the UK and some of the challenges we have, we're an aging population, so you can look there in terms of the trends. We're getting older. The proportion of people living over 65 is getting older, and that's not just a UK problem. We see that across the globe. And when you look at the actual healthcare costs associated with that, it's pretty crazy. In 20 years, the amount we spend on our public services to deliver health has gone from about £50 billion to £200 billion nearly in 2017. We all talk about the NHS shortages, but every year there's more and more money going into the NHS services, but every year we're more and more stretched in how we provide care. Aging is an issue, but we've just talked about another issue in terms of what we see in society being air quality. This headline really talks about the impact to the health services from air quality, and also to the individuals that are dying each year from it. But in health, we see key problems. It relates to strokes. We see heart disease, lung cancer, COPD. All these conditions are caused by issues with the air quality around us. And when you look at that in terms of deaths, it's pretty crazy, right? So in the UK, there's 40,000 people dying. Globally, there's 7 million people dying. And if you just think about Europe, and there's a lot going on about Europe right now, there's 400,000 people every year that die due to something we could prevent if we actually had better air quality around us. If you think about that in terms of numbers, I was just trying to think of some ways to talk about it. You've got, 30,000 people watching Sheffield play Hull tonight, so they're wiped out every month. You've got an airplane full every 5 hours that could go down, and that'd be how many people just in Europe are dying from preventable air quality-related diseases. And if you looked around here and it was full, which is not too bad tonight, but imagine it was jam-packed, one of these rooms jam-packed every 3 days. That's how many people we're talking about. That's how many moms, dads, brothers, sisters that are dying due to issues that we could prevent. So at Upstream, we're not unique, but we believe there's an answer. We believe there's a better way. So I talk about a story, so if you imagine there's a river, and down that river we've got patients flowing to a waterfall. The most natural thing to do when you see those patients in need is jump in and grab them from that waterfall and pull them out of the water. And that's what we do in healthcare. We go to the people most in need at the waterfall's edge, we grab them out, we pull them out. But we can't stop. These patients are still flowing down this river. So at Upstream we say we want to do something differently. So we jump in the river and we swim past those guys that are grabbing the patients out, and they're shouting us, say, we've got patients dying here. You need to come and help us. We say we can't because we've got to go upstream. And they say, why? Why do you need to go upstream? Because we want to stop them from falling in the first place. If we can stop patients from getting sick, if we can resolve some of these, what we call social determinants of health, is a patient getting out? Are people getting out and, meeting others? Are they not being lonely? Are they eating well? Are they getting the right fluid? Are they getting the right diet? Have they got the right air that they're breathing on a daily basis? If we can fix these things, then we know we can resolve some of the big challenges we've got as we age as a society. And when you look at that in terms of the systems, you can see, we've got a lot of spend that's been invested at the back end of that process. In the healthcare system, we put 95% of our costs, 95% of our effort at the edge of that waterfall. But we know that actually, if we invest at that front end into social care services, into stuff to help people from being lonely, to help join up people in the community, we can make a massive difference. And we know from the BMJ that for every pound that we invest upstream, into air quality improvements, into stuff to actually help our society, we can save £14 at the waterfall edge. So that's a bit of the background about upstream thinking. We're going to talk a bit about that in a minute. But I just want to say the government's behind us in terms of what we're looking to do. And as a business, we're all about, in Upstream, helping those guys at the bottom half of that, the bigger population, and keeping them well and escalating. In terms of what that looks like, in terms of what we actually do, This is an example. So this is my granddad, Dougie, behind you. So you can see, he's 80 years old in this picture, but over the last 7 years, Dougie's had a number of falls, a number of issues that have meant he's had to go into hospital. That's been a lot of costs, and it's been quite hard for my mum to coordinate what's going on with him. And in the health tech space, I know there's not solutions out there to keep Dougie well. I used to run a community care nurse team, and we struggled to find the right solution for people like Dougie. We looked around, but most solutions, weren't designed for the elderly population. Didn't look after people like my mum, and didn't really help the stretched care teams we had. So at Upstream, we wanted to do something differently, and something that allowed us to connect people like Dougie to the people that are important to him. People like Dougie aren't online. Most of those guys don't have any internet connection in their house. They don't have access or can use mobile phones. So, working with companies like Connexin, we looked at how do we connect those people to the people that matter. We produced something we call Bridget, something we're proud of. So Bridget brings together IoT for the patient, so a new device, brings together artificial intelligence technologies, so we can look into the future for a patient, and supports family members. The way it does that is relatively simple. So we've got a simple device that we attach to the front of a patient's fridge. Collects a load of cool information from the patient and their house. So, what's their indoor air quality? Is that patient moving? Are they getting out? Are they doing enough? Sends that information to their family members. So actually, I can know that Grandad's up. I can know that he's got his kettle on. I can know he's actually accessing the fridge. But more importantly, the health teams can see what's going on as well. So that when over 6 weeks, his patterns start to deteriorate, he's starting to feel lonely, we in the care space can then do something about it.
Upstream Health is on a mission to help keep people well. We do this by using innovative technologies to support patients and care teams. Upstream's new solution is Bridget. Bridget bridges the gap between patient and carers, supporting patients, reassuring families, and informing clinicians. Bridget is designed to be easy to use and unintrusive within the home. She's designed for people that might not have internet or know how to use mobile apps. Bridget lives in the kitchen, the hub of the home, where she automatically collects key data such as temperature, movement, air quality, fridge access, and information from the owner such as heart rate, SpO2, and external body temperature. Through the scanner, she can collect information from visitors and when medication has been taken, with the ability to ask for support. Bridget sends this key information securely to the people that matter, either as a text message alert, with more detailed information through the Bridget app, or using Bridget's artificial intelligence to provide direction for care teams.
So that's a bit about what we're doing in Hull. What we're doing as a small business, and something we're doing in Connexin. If you guys want any more information, then grab me later, and thanks for listening.